So far, 2D morphing is not common practice amongst rhinoplasty surgeons. I would not do any surgery without 2D morphing because it helps me to discuss with the patient the precise desires. It helps me also to select the patient that will be satisfied with a certain result, and therefore I think 2D morphing is really mandatory as a tool in the preoperative evaluation of patients seeking rhinoplasty. Going one step further than 2D morphing would mean 3D morphing, and according to my clinical practice, 3D morphing can be an added value in about 30% of the patients where you experience shortcomings by 2D morphing. Meaning that in some patients you feel like 2D images cannot provide them with the full view and full comprehension of how their nose will look like after surgery. And in those patients, 3D morphing can be a real added value.
The 3D morphing, the way that they call morphing, I don't like much. I prefer to say to explain the patient what the patient needs. Sometimes the patient is not aware of what she or he really needs. It's something that the doctor knows when you look at the face of the patient. Sometimes the patient needs a chin augmentation instead of only the rhinoplasty. But the patient doesn't know these things. So with the 3D morphing, you can explain the patient much better what the patient needs and where to apply the right surgery. And the 3D system at this moment are really easy to use. Everybody can do it. You don't need to be a doctor. You don't need to be a photographer. So when you have your patient in your practice, everybody can take a picture with at least our systems. And then the doctor needs to look at the picture and have a consultation with the patient.
3D morphing is a very complex tool. First and foremost, we look at 3D morph pictures on the screen, which is two-dimensional. So trying to make a patient understand what we can reach with it takes time, and also experience and practice for the doctor to morph. I think it's a tool that is of strong debate. Some people do it, some people really don't want to do it. I think it's very helpful to understand what expectations a patient has, and it's also very helpful for a patient to see how it actually will affect the appearance of their face once you change the nose. So it takes time, but I think it's very, very useful once addressed in the right place.